This voiceover is going to cover respiratory anatomy and physiology. You should have a baseline knowledge of this content as we move forward in the respiratory lectures. This image shows the upper respiratory tract. This image shows the lower respiratory tract. The physiology of respiration consists of oxygenation, ventilation, compliance, and resistance. Oxygenation is the process of obtaining oxygen and making it available to the organs and tissues. The lungs' ability to oxygenate is evaluated by the partial pressure of oxygen in the arterial blood, the arterial oxygen saturation, and the patient assessment. Ventilation involves inspiration and expiration. We breathe using negative ventilation, and this is because the atmospheric pressure is higher than the intrathoracic pressure. Compliance is the measure of the elasticity of lungs as well as the elastic recoil of the chest wall. Compliance is reduced with pulmonary edema, acute respiratory distress syndrome, pneumonia, pulmonary fibrosis, and pleural effusions due to inflation difficulty. Compliance is increased with COPD due to the destruction of alveolar walls and loss of elasticity. Resistance is the obstacle of airflow during inspiration and/or expiration. Asthma or secretions can increase resistance. The body's ability to control respiration is located in the brainstem. The respiratory center, or the medulla, responds to chemical and mechanical receptors. The medulla sends impulses to the respiratory muscles through the spinal cord and phrenic nerve. Chemoreceptors are receptors that respond to a change in the chemical composition of the fluid around it. Mechanical receptors are found in the upper airways, chest wall, diaphragm, and capillaries of the alveoli. Chemical receptors are stimulated by irritants, muscle stretching, and alveolar wall distortion. The body has several respiratory defense mechanisms. The first one is filtration of air. An example of this would be nasal hairs and their ability to filter inspired air. The mucociliary clearance system consists of goblet cells and submucosal glands that secrete protective mucus. Immunoglobulin A in the mucus protects against bacteria and viruses. Cilia moves mucus towards the mouth. The cough reflex is a protective reflex that clears the airway and removes secretions. Reflex bronchoconstriction is where the bronchi constricts to prevent entry of irritants. Patients with asthma may have bronchoconstriction when they are exposed to triggers such as cold air or perfume. Alveolar macrophages are able to break down inhaled foreign particles such as bacteria. There are numerous pediatric differences in the respiratory system. Children have a shorter airway, and the airway is narrower than adults. Their larynx is flexible and easily stimulated to spasm. Their intercostal muscles are not fully developed. Children have pronounced abdominal wall movement with breathing, and this is normal. Children have a higher metabolic rate, which requires a higher oxygen demand. Their respiratory rate is faster, and children have larger tonsils and lymph node tissues than adults. Aging can have an effect on the respiratory system. In the elderly, they may have calcification of the costal cartilages. They could have a barrel chest or kyphosis, which is an abnormal shape of the spinal cord. This can result in a decreased chest wall movement, deep breathing, and cough effectiveness. They have a decreased immunity, a less forceful cough, fewer and less functional cilia. Their mucous membranes tend to be dry. They can retain mucus, which increases their risk for developing respiratory infection, and they're at a higher risk for aspiration due to difficulty swallowing. Their respiratory control is diminished, and this is because they have a decreased response to hypoxemia and hypercapnia.